Vardenafil is a medication that can be given to you to treat erectile dysfunction. It is classified as a PDE5 inhibitor. It is available as a tablet under the brand Levitra. However, before using this medication, you should know key facts about this medication, like what is the best time to take it, how it improves your condition, which other medications should be avoided, what is the effect of alcohol, and many more. This video will cover all such key facts about this medication. First, let's see how to take this medication. You can get Vardenafil tablets in two variants. One is film-coated tablets that are available in 4 strengths: 2.5 milligrams, 5 milligrams, 10 milligrams, and 20 milligrams. They are to be taken only once a day. The second variant is oral disintegrating tablets that are available at a single strength of 10 milligrams. They are also intended for use only once a day. For treating erectile dysfunction, the typical dose of Vardenafil is 10 milligrams, taken 1 hour before sexual activity. Your doctor may either increase or decrease the dose based on the response and your existing health conditions. Your dose may be increased to 20 milligrams if a significant response is not observed. However, this maximum dose should be used only when it is recommended by your doctor. If you have any liver dysfunction, your doctor may reduce the dose to 5 milligrams. Never take Vardenafil beyond the dose recommended to you, as it may produce very serious complications. Vardenafil is rapidly absorbed into the body, and it shows its onset within 1 hour. It is a short-acting PDE5 inhibitor, and it can show its actions for up to 4 hours. Therefore, you can take it 1 hour before the intended activity. However, Vardenafil can't work without sexual arousal. Therefore, it should be taken according to the sexual activity. It is always better to take 1 hour before the sexual activity for a better response. You can take this medication with or without food. Now let's see the precautions of this medication. This medication works for up to 4 hours, and therefore it can show its effects for only a few hours. Normally, the erection can be reduced after ejaculation. However, in a few people with structural abnormalities in the penis, the erection may last up to 4 hours. This prolonged erection is called priapism and is highly painful. It even causes further damage to the erectile tissue. The risk of prolonged erection can be enhanced by the presence of cancerous blood cells. Therefore, if you observe any prolonged erection, immediately stop this medication and consult your doctor. You should be cautious when you take other medications with Vardenafil. If you are taking potent CYP3A4 inhibitors like ritonavir or ketoconazole, they may increase plasma concentrations of this medication. In such cases, dosage adjustment is necessary, and the dose should be reduced to 5 milligrams. You should take this medication cautiously with other vasodilators like alpha-1 blockers. Medications like prazosin, terazosin, and doxazosin come under this category. They are used to treat hypertension. However, they cause significant hypotension and dizziness when combined with this medication. You should avoid a few medications that may cause QT prolongation. Class 1A antiarrhythmic agents like quinidine and procainamide or Class 3 antiarrhythmic agents like amiodarone and sotalol can increase the QT interval. Therefore, these medications should be avoided. Therefore, if you have had any heart problems in the past 6 months, this medication should be used with caution. If you have recent heart attacks, heart failure, or unstable angina, use of this medication may not be recommended for you. In people with left ventricular outflow obstruction, use of this medication may significantly increase the risk. This medication may affect the neurons supplying the eye, especially in people with ages above 50 years. They may not be able to discriminate colors properly. However, in people with defects in the optical disc, this medication should be carefully used. If you have a low cup-to-disc ratio, a sudden loss of vision may be observed. A few risk factors, like elevated levels of cholesterol, coronary artery disease, chronic hypertension, and diabetes, may also cause damage to optical neurons. However, loss of vision may not be observed in all people, and it is particularly more pronounced in men with pre-existing structural abnormalities in the eye. If you observe any sudden loss of vision, immediately stop using this medication and consult your doctor. This medication can cause dilation of your blood vessels, resulting in a drop in your blood pressure when you stand from a sitting or lying position. With that, you may feel dizzy and lightheaded. Taking large amounts of alcohol simultaneously with this medication may severely impact your attention. It can also reduce erection. Therefore, the effectiveness of this medication may be reduced in the presence of a high intake of alcohol. You should be careful while using this medication, as it can affect your hearing abilities. You may have dizziness and lightheadedness initially. This is quite common, as this medication causes dilation of your blood vessels and reduces your blood pressure. However, if you notice other symptoms like any noise or ringing in your ears, it may indicate an effect on your hearing. You may also observe reduced hearing or even sudden loss of hearing. You should be careful to notice any changes in hearing as early as possible. In case of a sudden decrease in hearing, you should stop using this medication. Vardenafil works by dilating your blood vessels. It is classified as a phosphodiesterase 5 inhibitor. In people with erectile dysfunction, blood vessels supplying erectile tissue are insufficiently dilated. This results in failure of erection. Dilation of blood vessels is carried by an enzyme called cyclic GMP. It is an enzyme that causes phosphorylation of proteins in vascular smooth muscle that prevents entry of calcium and inactivates contractile proteins. This results in relaxation of blood vessels leading to erection. However, the action of cyclic GMP is limited by its breakdown. An enzyme called phosphodiesterase type 5 is responsible for the cleavage of cyclic GMP. Vardenafil inhibits this cleavage enzyme, thereby increasing the levels of cyclic GMP in vascular smooth muscle. This results in dilation of blood vessels supplying the penis, improving erectile dysfunction. What are the side effects of this medication? One of the most common side effects observed in many people is the headache. You can observe this side effect from the first dose itself. This medication can cause dilation of cranial blood vessels that can induce headaches. The severity of headache increases with dose. You can also feel dizzy and lightheaded. Flushing can be observed, leading to redness in the face and neck. You can have congestion in your nose again due to the dilation of nasal blood vessels. Indigestion and back pain are a few other side effects observed with this medication. That's all about Vardenafil. Thanks for watching this video, and if you find any interesting facts on this medication, please share them in the comment box below. Please do subscribe and hit the like button. I will come with another interesting video in the next week. Until then, have a nice time, take care, and goodbye.